Good evening, everyone. We have
Good
a
evening.
very important topic to discuss today. High blood pressure, which is commonly known as hypertension, and chronic kidney diseases are closely interlinked. In fact, it has been very well established that hypertension is the leading cause of kidney disease and kidney failure, which is also known as end-stage renal failure, and can cause severe damage to the blood vessels and the filters in the kidney, which is why it is very important to keep the blood pressure in check, because otherwise removal of waste from the body via the kidney becomes very difficult. Once a person is diagnosed with end-stage renal disease, then dialysis, which is a blood cleansing process, or kidney transplantation become almost mandatory. Over time, uncontrolled high blood pressure can cause arthritis around the kidneys to narrow, weaken, and harden. These damaged arteries are not able to deliver enough blood to the kidney tissue, leading to massive damage. Now, some of the symptoms of kidney disease resulting from hypertension, which one must keep a lookout for, are high worsening blood pressure, difficulty in urinating, excess fluid in the tissues, commonly known as edema too, and frequent urination at night. Studies have shown that in India, the prevalence of hypertension, especially in young adult population, is slowly on the rise. It is becoming almost an epidemic. Now, what are the top risk factors leading to hypertension, in the young particularly? Well, they are smoking, mental stress due to overactivities and maybe certain extrinsic factors that are not really in our control, and overweight, obesity, which is also a huge factor these days. Now, this is a topic that is not discussed enough, and there is an urgent need to spread information about it, right information about it. And which is why IHW has chosen a very, very important day, the World Kidney Day today, to help correct this and educate people about it, with the help of a very eminent panel of dignitaries who have joined us today for the session. We are absolutely delighted to have with us today Dr. Professor A.K. Bhalla, Chairman and HOD Department of Nephrology, Sree Gangaram Hospital, New Delhi. Dr. D. Sree Bhushan Raju, Professor and Head of the Department of Nephrology, Nizam's Institute of Medical Sciences, Hyderabad. Dr. Santosh Varughese, Professor and Head of the Department of Nephrology, Christian Medical College, Vellore. Dr. Umesh Khanna, Consultant Nephrologist and Transplant Physician, Mumbai. So let's dive right in and get all our facts right about kidney and its connection with hypertension. Welcome, everybody. We are very, very happy to have you all, sir. Let me just start with the first question. Dr. Varughese, maybe if you can take this one. An estimated 26% of world's population suffers from high blood pressure, which common people know as hypertension. And the prevalence is expected to increase to almost 30% by 2025, which could shoot up cases related to kidney diseases too. And end-stage renal disease will be, of course, we'll see a markup there as well. So what are the additional risk factors along with those that were already there, which continue to impact a significant chunk of world's population? Dr.
Okay, so if I understand correctly, what are the additional risk factors that hypertension causes on these people?
Yes.
So a couple of things. One, hypertension itself causes kidney disease. Kidney disease often causes hypertension. Hypertension causes, or rather is a risk factor for cardiovascular disease. Uncontrolled hypertension is a risk factor for progression of kidney disease as well as progression of heart disease. So putting all these things together, if we have increase in the prevalence of hypertension with increased longevity of mankind nowadays, I believe the average lifespan of the Indians in India is about 69 point something years as of 2019 census. If so, we are looking at increased CKD by virtue of just having hypertension. If you add to that uncontrolled hypertension, you have a worsening of CKD and causing end-stage kidney disease. Whereas if the systolic is more than 140, whereas if the systolic is more than 120, but it's less than 140, your kidney disease may not increase, but your heart disease certainly does, and mortality due to heart disease certainly does. So increase in hypertension by itself is bad news. Uncontrolled hypertension is bad news both from the heart and the kidney point.
Yes, that of course makes it very, very clear, very clearly put, sir. We'll move on. I mean, hypertension is so common, but somehow I feel not enough is known about it, or there are so many myths, and everyone has their own theory on how to really handle this very prevalent issue. So, Dr. Raju, if you can just help us with this, how does one manage a person or a patient, I would say, with hypertension? What are the basic do's and don'ts for people who are suffering from hypertension so that it doesn't really cause further problems in the body?
Yes, it's a very important and a very interesting question also. We don't get to receive these kind of questions routinely, actually, in academic forums. It looks very simple question, and but it socially is very, very relevant. I need to express my thanks to you basically for putting this simple question, but it's very important in the general public, because I used to run one clinic called Hypertension Clinic in Nizam Institute of Medical Sciences when I just joined. Almost till 2010, I continued it from 2002 onwards. Almost 8 years, I continued the hypertension clinic. And I realized that the only intention was to see that the catchhold of the people very in a hypertension stage, and so that if I treat effectively, and I'll see how many of them can prevent progression towards the chronic kidney disease. Then I realized that not many people were there to take up such a thing. So your answer for your question, that how to tackle these patients with hypertension, is to first let them believe that they have hypertension. It is very, very difficult to make them understand and accept that they have a hypertension. It's very, very difficult. They will never. And they just see that most of the time the hypertension is detected when they go to a doctor for non-specific and vague complaint, something like a neck pain, cough, fever, some occasional non-specific headache, and some body weakness or something like that. Or maybe accidentally detected during the pre-employment examination for this generation now, especially the software companies and all. But when we tell them that you have hypertension, which is significant, they invariably, the denial is the most important phenomenon that obstructs us from treating the patient with hypertension very effectively, because nobody accepts so easily that they have an hypertension. Unfortunately, hypertension has no clinical manifestations externally. Overtly, they will never manifest that they have some complaint. And they have non-specific complaints, which they automatically, they get rid of them simply by taking simple painkillers, some paracetamol and all other things, or taking rest or something like that. They attribute that to something like a pressure of being in the clinic, or being seen by a doctor, or being surrounded by so many people, and the very reason that they are being examined by a doctor. So these are the reasons which they attribute. And even if you say that it's significant hypertension, they say that, no, doctor, I'm very happy and healthy and I don't have any hypertension. So as far as the management of hypertension is concerned, tackling the patients is concerned, I feel that it's a responsibility of the doctor to make them understand and accept that they have hypertension, which is very, very important. Then afterwards, the most important second one is called the drug compliance. Drug compliance is also very difficult one. And I being a hypertensive little bit, and I have to take one tablet every day, and which I frequently tend to forget. And thanks that my wife is always there to remind me that I have to take an antihypertensive, because she'll be there around, and that's another cause of hypertension for me. And simply I'll be taking the particular drug every day regularly without failure. But not the case with each and every one. And many people have to take 2 or 3 tablets, especially patients with the chronic kidney disease. They have to take more and more tablets. So very difficult to make them understand that They have to control their blood pressure irrespective of the number of drugs they take every day. So they feel that one drug and two drugs are okay, and why they should keep on taking so many drugs which the doctors prescribe. Till recently, when the patients were not aware that they can check the blood pressure at home, they were being checked by a doctor who knows the number. And sometimes the doctors are also very diplomatic and they are very good. And because they are branded, all the doctors are branded as being good to the society. Actually, we can't, even if I am bad also, I cannot express my inner feelings towards anyone. So sometimes we don't hurt the feelings of the patient. We say, even if it is a 180 or something like that, we say, okay, 150 to 160, and you be careful. Even if the diastolic is 110, we say it's 100 only, so don't worry, but you take this tablet. We try to convince them by all means. But now other digital BP apparatus is there, and they're checking it on their own at home, and they're coming. In fact, to be very frank, I stopped checking the blood pressure in my clinic. I tell the patients that you please check the blood pressure at home, and afterwards you should not blame me saying that by looking at me and my environment in the hospital, your BP is up. So you cannot blame me for that. You get your BP numbers, and I'll treat the BP numbers, whatever you get, and be sincere. And at least you be sincere, unlike the doctors in writing the BP numbers. So you write the truth, the number, the truth only. Don't manipulate and say that 120 by 80, 120 by 80 and all. So when they come to me, then I treat. So this I have been doing for the past almost 4 to 5 years. They only check it up. So compliance with the drug and a careful monitoring. So I say first one is that let them accept that they have the hypertension, which is to be treated, which is the simplest disease on the earth. And at the same time, the greatest disease which can kill 50% of the population every year. And the second one is the drug complaints. Third one is regular, frequent, a disciplined way of monitoring of blood pressure at home is very, very important. These are the three things which we can tell the patients to tackle hypertension in them.
So just a follow-up question to you only. Do you notice this more in the younger lot, or is this universal across ages, this denial?
No, this is actually irrespective of the age group, actually. Even if the patients are 60 and 70, because they enjoyed such a good age till then, they will not accept even if it is the 60s. So young people, anyhow, they presume that they're all healthy, actually. Unless some film star or somebody suddenly gets into shock and collapses during the shooting or something like that, the society will not get startled that with the present, with some film star getting into some cardiac problem or something. Then they start queuing up in front of the clinic saying that I might be having some problem, you please check me up. That goes on for a few weeks before they forget about all these issues and all. So youngsters, that's a common, and where denial mode for the youngsters are very, very common, not only for this hypertension, for any kind of a disease, they first deny. And that is a human psychology, I believe. And then afterwards, they slowly accept. So if I tell them that unless you want to manifest or experience the thing you will not accept, means you need to experience the worst. So that time you may not be there to experience, accept, your family members will be there to accept. So you please understand and you try to accept now itself. Kidney disease is also the same. They don't accept so easily, especially when they have no symptoms at all. Yeah.
So the point is first acceptance and, avoidance of denial. As you said, I think that's more than half the battle won. And I don't know if you would agree with me. I find that there's a gender issue as well. Women tend to be even more complacent about their hypertensive issues.
Yes, the gender also equally important. And women, they don't accept so easily because they have non-specific complaints altogether. And most of the times they think that they have their work pattern at home. And also the husbands are the most frequent culprits for their hypertension. And they say that it's all because of him. He never keeps me happy at home. And all these things, they will have complaints always. So there can never be an absolute, universally good, acceptable husband in the world. And they attribute that to them. And also the work pattern in India is very difficult for the woman, actually. They never take any food properly, breakfast, lunch, dinner. There's nothing like a timing. And nothing like sleep pattern also is very much disturbed for the woman. And most of the times they sleep late and they get up very early. And because that is the reason why they'll be tired very frequently compared to the men who can take a better sleep overnight. So that's another reason why that's why they attribute all the hypertension male symptoms, other symptoms also to the lack of energy and the lack of proper rest and this thing for their symptoms, actually. That's why they don't immediately accept it. But usually they are, in fact, as far as the compliance is concerned and monitoring is concerned, they are the best, actually. They are the very compliant with, especially the youngsters, boys, they don't really do that. And the old men and women, they do. Among the girls, they do very well. And the middle-aged women, they take the drugs very regularly. And compliance is concerned, the women are the best, and the youngsters also, irrespective of the age group, all the women actually they take, but they have to accept it, actually. It will take some time for them to accept, but once they accept, they take it very regularly, and they come very frequently with a very beautiful book. They write all the BP numbers and all other thing, and first they write in a rough paper, and they make it very in a good paper. They sit and write all the things, because I love them. To show to me, they get a very beautiful book also they maintain. So that's what. Gender also makes a difference, but unfortunately they get detected very late. They rarely go to the doctor, because as I stated that, because of the symptoms which they have.
This disease is actually worldwide, considered as a silent killer, because often, in fact, very often it's detected at a very, very late stage. So Dr. Bhalla, really, I would like you to educate everyone on maybe the 4 stages of hypertension, and what are the early symptoms that no one should really miss of hypertension.
Thank you, Dr. Kavita. I would like to thank this IHW Council for arranging this webinar. So before I talk about the various stages, from patient point of view, it is only either mild hypertension or severe hypertension, simple. If mild means he is most of the time asymptomatic, and severe means when he is having complications and his day-to-day life is bothered or he is disturbed because of hypertension. So that's from patient point of view. But as Dr. Raju already has highlighted, we must know first, everybody should know that there are 3 ways of monitoring blood pressure. One is what we do is office blood pressure. This is actually the most inaccurate. Now, second one is home blood pressure, what Dr. Raju was saying. So what they bring the record, and then we see the record. Maybe they are doing it every 4 hourly or 1 hour, 2 hourly, whatever they can do, or morning, evening, even morning, evening. So they bring that booklet and we see that. And third one, the best, most accurate, most sensitive is actually ambulatory blood pressure monitoring. That is 24-hour record. And then we have a mean of that. So everybody should know that these are the various ways of measuring blood pressure. So then as we stand today, every blood pressure hypertension patient should have home recording. Then next is one should know about the various apparatus available. The mercury one, everybody knows that there is a sphygmomanometer with mercury column that is now banned by Government of India. So now we have Android and digital blood pressure apparatus. So all these like Omron, etc. are available, and patients, this microlight with similar reading, microlight with the 3 readings and the mean. So all these are available in the market. If you go to Amazon, you can easily order these oscillatory methods or digital methods blood pressure apparatus. So with that background, now if we want to stage the blood pressure, it has been made quite simple actually over the last 2-3 years. In normal blood pressure, now we take, irrespective of the age, is less than 120/80. The point to be stressed is that even elderly population also, now once there is a study, large study from US, that is Sprint study, which showed that even in elderly patients also, if we control the blood pressure to that reading, we can prevent various cardiovascular as well as cerebrovascular complications. So 120/80 is normal, and when it is 120 to 129 and 80 and diastolic 80, that is called pre-hypertension or mild hypertension. Now stage 1 and stage 2. Stage 1 will be moderate hypertension, when systolic blood pressure will be 130 to 139 and diastolic will be 80 to 89. And once the blood pressure is more than 140/90, then we call it as severe or stage 2. So now if you see, it is quite simple: normal, pre-hypertension, stage 1 and stage 2. Because earlier we were having various other classification like JNC 9, now latest available. These are all actually even recommended by American Heart Association as well as American Association of Cardiology, European Society of Cardiology. So all actually agree with this staging. However, in some of the stages, they say that if the age is more than 60, then the reading, then they say it is at 140/90. Now, as far as the target treatment is concerned, our target should be to bring the control to 140/90 But if patient is having congestive heart failure or coronary artery disease, then you have to bring the blood pressure to 130/80, which already Dr. Varughese has highlighted that in these two conditions, blood pressure has to be slightly brought down to lower level. Now, as you have said, the symptoms, most of the times with mild hypertension, patient will be asymptomatic. The commonest symptom will be headache, and that too early morning headache. So if a patient complains with early morning headache, then one should suspect hypertension. And if we are not able to record that, then maybe ambulatory blood pressure monitoring, 24-hour monitoring should be done in these populations. Then worsening of blood pressure can be there. That earlier it was high, then in between it was normal recording, and now came with very severe hypertension. Then edema, swelling of the feet, swelling of the face, can be because of cardiac involvement or kidney involvement. And then patient can have nocturia, as you had already highlighted. Then breathlessness because of cardiovascular complications and cerebrovascular accidents. Patient can have a small bleed in the brain. Patient can be dizziness. Patient can have throat seizures. Patient can progress with coma in casualty. So these are the various symptoms where there will be sudden high blood pressure or sudden worsening of blood pressure, or patient is not compliant and now patient has got some complications or super added like renal complications, or in elderly population, like patient may be having atherosclerotic aortic disease and atherosclerotic renal artery stenosis. So these are the various causes of worsening of blood pressure in these patients.
Great. Dr. Bhalla, another question. I mean, just something I feel that we must talk at least briefly about. That as far as primary care, care of patients in primary care in India is concerned, how can we really adopt a patient-centric approach in service delivery? How can we? What are the simple few factors that can help improve the quality of care for hypertensive patients in primary care?
First of all, I think the screening is very important.
Okay.
The screening, maybe if you can do a screening, maybe even a once in a year blood pressure recording, that is how to pick up the patients, right, to find out the actual incidence and actual prevalence of hypertension. So screening of the population is very important. What I do is, whether patient is having hypertension or not, I always, and this is from my days of medicine and when I was doing MD medicine. So every patient whosoever comes to me, I will always check blood pressure. So that is one thing. So every general physician, actually, if you go actually practically, the GPs who are doing MBBS routine practice, they do not actually check blood pressure in their clinics. So patient comes with some eye problem, they will give treatment, symptomatic treatment, some ear problem, some chest problem, some cough, fever, most of the time fever, diarrhea, vomiting. So they will just give that symptomatic treatment. But I think blood pressure recording should be done whenever a patient has visited a doctor, whether GP, whether a physician or cardiologist or nephrologist, whatever it is. That is, I think, most important thing. So screening has to be there. Number two is, once the diagnosis has been made, then we have to stress on the compliance. That first of all, we have to make that patient accepts the disease, as already highlighted, because acceptance is very important. And we have to stress that it is not something which will get cured. So once hypertension is there, by and large, it will be lifelong, and he will have to live with it, and he will have to take medicines regularly. And third is now various reversible factors actually. So these reversible factors should be looked for, because in India, it is becoming a diabetic capital, number one. Number two, the obesity is rising in alarming proportion now. Metabolic syndrome and obesity, overweight, BMI more than 30, more than 35, that is very common now. Not only in adults, in children. Our IAP did one study in Delhi where they found that almost 13, I think for 15% of patients, children were found to having hypertension, which was not diagnosed, which was just detected on screening. And the prevalence has increased to about 33% in metro cities and almost around 18 to 20% in rural population. So rural population also is not is now being spared. That is because of our lifestyle. Lifestyle has to improve. Once they have been diagnosed hypertension, we have to tell them to practice yoga. Very important. 30 minutes of yoga, 30 minutes, 45 minutes of daily light exercise, morning walk, reduce stress as much as possible, avoid smoking, avoid too much of drinking, avoid salt intake. I'm sure Dr. Umesh Khanna will highlight that, because that is his topic. But salt restriction has to be to as low as possible, because even if you do not take salt, still all these vegetables, everything, whatever we eat, will still provide you 2 grams of salt in your diet. So these things have to be highlighted. If someone patient has got hypertension, how he can live with hypertension now.
Great. Yes, I think we have two very eminent people insisting on, doing away with denial, which is, I think, such a big point which is coming out. I guess that's a huge problem, which is why both of you have highlighted it. And I hope everyone listening will really take note of that. Dr. Khanna, really, I would like to move on to you here, sir. What other chronic kidney disease risk factors are very important to screen in adults already with hypertension?
Right. The best question that you asked, am I audible? Yeah.
Yes, sir.
The best question that you asked was to Dr. Bhalla. How do you look into primary care? And in fact, just taking it from there, I run an organization called Mumbai Kidney Foundation, and I wanted you to highlight these slogans for everybody. Sure. The first slogan we have, and which is the answer to your question also, is know your numbers. Every adult should know his blood pressure, BMI, and sugar. Now that kind of leads to the answer to your question also. What are the other factors which probably are important in a hypertensive, or which can lead to hypertension? And Dr. Bhalla alluded to it, that obesity and high BMI and the diabetes capital, which India is. And therefore, know your numbers is an excellent slogan, which we want to highlight today in this program. The women who are watching this program should have a perfect figure. When I say having a perfect figure, it's the figure of blood sugar, blood pressure, and weight. So the second slogan, which is important, is have a perfect figure. If you do not have a perfect figure, then start the third slogan, and that's an Ek Chammach Kam campaign. That means you reduce your salt, oil, and sugar by at least 30% to begin with. And then, of course, based on your, performance, we can look into what next. So 3 important slogans which you must highlight is know your numbers, have a perfect figure, and Ek Chammach Kam. I think the answer to your question as to what are the other factors, and I think to begin with, Dr. Santosh brought out very well that firstly, of course, there used to be a figure of 30, which we used to remember. 30% people do not know they have blood pressure, 30% even if they know don't get treated, and 30% even if they're treated don't get controlled properly. Abroad, this has improved. Almost 60 to 65% are aware now they are hypertensive or not, and almost 50% are aware, or rather they do take the treatment, and more than 30% are controlled in their treatment. While India, the response is much poorer. Less than 30% are aware, less than 30% take treatment, and hardly 11 to 20% get controlled with their blood pressure. And I think Dr. Santosh made a very, very valid point that the uncontrolled blood pressure can lead to CKD. In fact, if your pressure, as Dr. Bhalla pointed out, is more than 140, you have 2 times the risk. If your pressure is more than 160, you have 4 times the risk. And if your pressure is more than 180, you have 8 times the risk of having complications. And that's the importance of controlling your blood pressure. Therefore, uncontrolled blood pressure is a problem. Obese people are generally more likely to have hypertension. Diabetic people are more likely to have hypertension. As Dr. Raju pointed out, that one you do not know because it's asymptomatic. Yeah. And therefore, know your numbers. You have to, Dr. Bhalla said, go to any doctor. The doctor, even if he's treating a headache or an ear problem and an eye problem, should get his BP checked. Having known that you would, again, the 2 people have already talked about denial. Let me also talk that it's not just denial. When they start taking the treatment, the moment the blood pressure becomes normal, they stop the drug. Now the blood pressure is normal because of medicines. If you stop the medicines, it will again go up. So you have to reduce the medicines only if the blood pressure goes below normal. And that's one carry home or take home message which I want to point out today is having normal blood pressure doesn't mean you have been cured. You have been controlled. So if you have been controlled, you need normal blood pressure. Those who do not have blood pressure have normal blood pressure. Those who have blood pressure will have normal blood pressure after taking medicines. So once it's normal, don't stop the medicines.
Understood, sir. I think this is a huge point because I see, and I'm sure everyone sees around them, people who just stop the medicines arbitrarily. And this yo-yo of the blood pressure is, I guess, worse for somebody's health. Yes. The slogans were wonderful, sir. I think they'll stick in everyone who's listening.
3 slogans.
Yeah. All of them should stick in everybody's mind, and this take-home message should stick, I think. Yeah. Thank you so much. Dr. Varughese, I would like to come back to you, sir. Now, hypertension is a very important risk factor for chronic disease burden in India. It adds on hugely to it. So what do you think are some of the emerging trends? I mean, Doc, some of the trends have already been mentioned, some statistics have been mentioned, but would you really like to, take us through the emerging trends in hypertension epidemiology in the country? How are things and how are they panning out?
Okay, so if I understand the question correctly, how are the hypertension trends in the country as far as the numbers go?
And also anything else you would like to add in this particular field?
Yeah, so I'm not very certain of the offhand of the of all the numbers exactly.
I think the Indian numbers are 29%. More than 29% in 2019.
29%. Yeah, so and the urban is slightly more, maybe about 5-6% more than the rural.
36%.
Yeah, but
and rural is less.
So the rural is less. So we have conditions which are increasing in prevalence with time. So the earlier studies have shown less prevalence. The later studies are showing more prevalence. Okay. And with this, we've got increase in the longevity. So we've got an epidemic on our hands. We've got increase in the lifespan of individuals, and therefore we've got an epidemic on our hands. So these things are like friends going together. Cardiovascular disease, kidney disease, they're like friends going together to a party together. Let's go have fun. So they often accompany metabolic syndrome, hypertension, uncontrolled, especially if it's uncontrolled. Yeah.
All right. So the numbers are pretty, I mean, even if we don't really have the exact numbers, it does sound like an epidemic, actually.
Yeah. So 1 in 3 people out of the 6 we have here today, 2 of them could be having hypertension.
Wow.
Just to put it in perspective.
Yeah,
I'm sure will scare a whole lot of us listening as well, besides these 6 people. And that, I guess, is a good thing, actually. A little scare always helps, I personally feel.
Yeah, just to carry forward the trends which you were asking, Dr. Santosh Varughese, and I think all the speakers made a point about obesity. And a lot of us have now what is called as an obstructive sleep apnea. Dr. Bhalla talked about reversible factors. You must look for reversible factors. And a lot of it is now known that a lot of people who snore and who are obese, they do tend to have a reversible blood pressure. You correct their obstructive sleep apnea, they improve. Dr. Bhalla also mentioned about certain drugs which you take and your blood pressure goes up. So he was very right in saying that first you must look out for reversible factors, and many of them will be kind of, you get cured of your blood pressure into inverted commas. Rest of them get controlled, some of them get cured of it. And I think the point which was made by Dr. Bhalla and Dr. Raju is about the trend of measuring home blood pressure rather than office blood pressure. That's your more epidemiological trend. No longer it is only the prerogative of rich. No longer it is the prerogative of urban people. No longer it is the prerogative of only obese people. All the others can have high blood pressure. So it's a great leveler.
Yes, I think every disease is a great leveler, particularly hypertension, looking at the way the numbers are really panning out in the country.
May I just add to what
yes, sir?
May I just add to what Dr. Umesh said? I also have been recently telling people to check their blood pressure as soon as they wake up and before they go to bed,
Okay.
because that is the time when the blood pressure medicines may not have been taken in before that. So we have to see whether blood pressure is controlled round the clock. So this is something I recently started doing to my patients.
But is it only for, can I ask you, is it only for people who are hypertensive, or that's the time everyone should check generally?
Well, the point, of course, if this is to find out hypertension, it's like you're doing a 24-hour monitoring.
Okay.
There are something called dipping of nocturnal dipping and so on. But apart from that, if somebody is hypertensive and they're taking medicines, they typically will wake up at 6 o'clock. They might have breakfast and they take their medicine at 8 o'clock, check the blood pressure at 9 o'clock, maybe normal. But 6 to 9 may be uncontrolled.
Okay. So that's the
what
time.
he's mentioning is early morning surge.
Of recent times, I've been telling people, correct, the morning surge should be controlled as well. So you check the blood pressure in the morning and make sure that's controlled.
I think it makes absolute sense to me. For example, in my practice, I'm a nutritionist. I tell everyone to take only their morning weights. So now I'm going to start telling everyone to take their morning blood pressure as well. So then that should put things in perspective for everyone. Dr. Bhalla, just taking this whole trends thing a little further, just to discuss it and see if there is any semblance of truth in this. It has been noticed that Indian states which have greater human development, better social development, more urbanization. We did touch upon rural versus cities, but do these states who are doing better, do they report more cases of hypertension? And how does one mitigate this worrying trend, of the rural versus city divide in terms of higher cases of hypertension in the city to avoid the kidney disease epidemic in the future?
Actually, if you see the metro cities, metro cities will have almost 30-33% prevalence, 1 in 3, whereas in rural it is much lower, even varying from 11 to 15%. So I think one of the main factor is stress level. In metro cities, the stress level is much higher than the lifestyle. A rural lifestyle is definitely healthy lifestyle. They eat healthy, they eat raw vegetables, they eat a lot of fiber, 20 to 25 gram of fiber. Actually, they eat this millet, this ragi, bajra, jwar. This is still quite prevalent in rural population. Whereas if you see cities, we all eat refined food, refined sugar, refined flour. So definitely our dietary pattern is quite unhealthy in metro cities. The stress level already has been highlighted that it is much higher in cities as compared to rural population. Then obesity is much higher, in smoking incidence is much higher, and hyperlipidemia. Again, hyperlipidemia is seen much more in this metro cities, affluent population as compared to, because the rural population, they are doing a lot of physical hard work, especially in farmers, they are working physically. So this kind of complications are much less common in those. Then as OSA, again, OSA is one condition of obstructive sleep apnea, which is again seen in obese population, overweight population, and in metro cities. Then this consumption of NSAIDs, painkillers, chronic use again leads to hypertension. So that this self-medication is much common in metro cities as compared to rural population. So these are the lot of factors actually which will predispose a person staying in big city as compared to rural population. I have myself seen that the rural population, they have a totally different pattern of diseases as compared to metro cities.
So there is a huge, I mean, we need to really stress upon lifestyle changes here, including exercise and food, the kind of food we are eating. I think it comes to, of course, stress, of course, is another factor. So all of it just boils down.
I always tell my patients, that is one thing I do, is I always tell my patients to leave this wheat flour, go for this bajra, go for jawar, go for ragi. That's what I do to my patients. And whenever they want to eat fruit, eat whole fruit, eat a lot of vegetables. In your plate of food, 50% should be vegetables and fruits and 50% should be plain. So these simple tips I think are very important. And I am a strong believer that all diseases start from gut.
Absolutely, sir. Yes.
And salt limited, all animals who do not eat salt, their blood pressure is actually very low. Their lipid profile is much better. All those animals who are vegetarian. And now there is a concept of, from nephrology point of view, now there is a clear-cut advantage of plant-based diet as compared to this meat-based diet. So animal diet versus plant-based diet, non-vegetarian diet versus plant-based diet. Non-vegetarian is acidic diet. Plant-based diet is alkaline diet. So this has again, the non-vegetarian diet causes inflammation in the body, whereas vegetarian diet reduces inflammation.
Yes.
So inflammation leads to oxidative stress and accelerated atherosclerosis, hypertension, CKD. So I think at every step we have to, that's what actually I do to tell my patients. Now I have started since the day, now I am involved in nutrition. I have changed my practice and I always advise my patients in detail about the nutrition.
There is this case about a 20-year-old boy that I came to know. We were talking about children. I mean, 20-year-old is almost like a child if you're talking about hypertensive. And he was severely hypertensive, and there was absolute denial everywhere from family to friends that it is simply not possible. There is something wrong in checking, because how can a 20-year-old be severely hypertensive? But then I guess what you're saying is right. When his food audit was done, it was realized that 70% or 80% of his diet was processed food. And processed food, as we all know, has how much sodium in it. Even if you've done it for over the last 5 years, it could have led him to this hypertensive situation. Dr. Khanna, would you like to add on to a few other risk factors which are common in
we can take the salt thing a little more because salt is very close to my heart. And I think since we're talking of hypertension, salt is an important area, and here at least the rural and the urban population score almost equally, because in brought up with a culture of having a thali, and thali mein salt pehle dalte hain, then chutney, then achar, then papad, and then food begins. So that culture has to go, whether you are in village or you are in town side. The other thing is there are certain fast foods which are very rich in salt, and the bakery products. So people feel sodium has to be salty. Sodium need not be salty. Even sweet items will contain a lot of sodium. So the breads, the cakes, the pastries, and all that. So-called healthy foods like cereals, which are being marketed as very healthy, they also contain a lot of salt. Noodles, which is fast food, it has plenty of salt. In fact, one of the highest amount of salt. So anyway, salt being important, the importance of salt should be highlighted, and we should bring down the salt in the diet. What was the question? Actually, I got carried away by salt, because whenever I hear salt, I jump to try and talk about
any other lifestyle changes.
Oh, I think Dr. Bhalla put it out very well. The diet is most important. If you use non-pharmacological methods of controlling blood pressure, you can easily bring down your blood pressure between 7 millimeter to 10 millimeter, which includes salt restriction, exercise, yoga, meditation, kind of food which you was alluding to in the form of vegetables is most important. People do not understand. It's not just smoking, it is any form of tobacco. And I think that would be, and of course the lifestyle of the fast lifestyle, which we all carry along with us, which includes doctors also.
Okay.
The fast lines.
So all of us are in the same boat.
And of course, weight loss, as I said, all three numbers should be good. Your sugar should be good, your BMI should be good, your blood pressure should be good, and food and exercise, and 30 minutes of exercise at least 5 to 7 days a week, all that will be part of it.
Dr. Bhalla made a very important point about eating variety, and I also personally believe that that is actually a solution. Grain rotation, vegetable rotation, fruits rotation, just trying to eat a little of everything is, I think, the easiest solution to most of the issues that we are facing today. And
I'm sure give him a chance. He will talk about the colorful vegetables. He's very, attracted towards the colors of vegetables.
We'll do another full section on that.
I will like to, once Dr. Khanna said this, we have to change to rainbow diet.
Yes.
So rainbow diet is 7 colors. You can easily, go to nature, you will find red capsicum, green capsicum, yellow capsicum. If you see brinjals, you have white brinjal, you have purple brinjal, you have green brinjal. You have why nature has made carrot red, why nature has made this spinach green, why nature has made turnip red and white, why beetroot is so
Colorful,
very red. So I think these are all phytonutrients.
Yes.
Phytochemicals. And phytonutrients, they are big immune boosters. They are antioxidants. So once you eat this healthy food, I'm sure you can control cardiovascular disease, you can control hypertension, you can control obesity, you can control metabolic syndrome, you can control CKD.
And you can go on and live your best life, basically.
Yes. So that's why the color, actually this scientific term is rainbow diet.
Yeah.
I'm sure you must be aware of this.
Absolutely. Yeah. I think we should do a session just on food and this sometime soon.
We will invite you to our Society of Renal Nutrition and Metabolism. We have a national society and we do a lot of, Dr. Umesh Khanna is a very important part. All these panelists, they are faculty in that.
Yeah.
So we'll call you there.
Perfect, sir. Dr. Raju, I'm going to come to you now, sir. Now, the other connection that we must make here is, having hypertension increases the risk of getting type 2 diabetes, which again is a leading cause of kidney failure. And furthermore, individuals who have kidney disease and type 2 diabetes together are 3 times more likely to die from a heart attack or a stroke compared to, say, somebody who only has diabetes. So what do you think are the immediate steps? One, of course, people need to understand this connection between the 3 of them. And what are the immediate steps required to spread more awareness about hypertension and how it is not just hypertension or blood pressure alone, how it has so many offshoots and how it can really mess up all your other organs?
Yeah. Thanks for the question again. And otherwise I would have fallen asleep. I
always thought so.
So really, as you said, this is also a very good question. Actually, you compiled very nice, simple questions, but they're very nice questions and very informative to the people also listening to that. So basic pathogenesis of hypertension, diabetes is the same, like endothelial dysfunction. So when the endothelium is not well, endothelium is a red carpet-like thing, which is actually laid down properly inside the walls of the blood vessels. That's called endothelium. That is simple and sensitive, and that itself is an organ in the body. And it's stated that if you stretch out the endothelium of one person, it will occupy more than that of a football stadium. So it is such a big one for every human being has got. It's almost like a big organ in the body. So naturally, when it gets defunct, so there'll be some manifestations in the form of a disease. So one such thing is hypertension, and another such thing is called diabetes. So they both go hand in hand, and most of the people who develop hypertension very young, they can become diabetic. And those who are diabetics, they also can become hypertensive later. So, but why diabetics will develop hypertension is because of so many other reasons also. It may not be the so-called essential hypertension or some renal artery, the renal disease hypertension, but diabetic patients have got several other reasons also leading to ischemic nephropathy, where the blood vessels supplying the kidneys will get atherosclerotic changes, and because of that, our kidney directly is hit by diabetes. This one. And as far as hypertension per se is concerned, hypertension can be a manifestation of a compartment called glomeruli, which are the filters in the kidney. When they are damaged, they'll get hypertension. And also the tubules and interstitium, when they get subtly damaged because of so many toxins and other things, including uncontrolled hypertension itself, also they can get hypertension. But sometimes very frequently in some population, more than 50s and 60s years of age group, we don't find any reason why they develop hypertension. It is called essential hypertension or primary hypertension. But most of the times, when we evaluate thoroughly, we fail to find out a reason, but invariably they land up in coming to us with a renal disease later. So it shows that If the blood pressure is uncontrolled, it can hit the kidney also mercilessly, and they can get damaged. So hypertension, the kidney link is very, very important. The one, like the way I said, the diabetics and hypertension, they get both of them together. I always say that it is actually the hypertension is produced in the kidney, and it will hit the kidney only hard later. So it is very, very important. Even if any other reason is there, sometimes there can be small tumors which are there situated above the kidney called adrenal gland. In that there's tumors, they also can lead to hypertension, but they also can have kidney damage. That shows that most of the times it is the kidney that is a culprit, but you don't have to label everyone with hypertension as the one with the kidney disease. But definitely hypertension is originated from the kidneys, and it will hit the kidneys only later afterwards. So diabetes and hypertension is both, both of them go hand in hand. I always compare them with the power and corruption. Actually, the power attracts the corrupt, and the corrupt people only will get into the power. It is something like that. So it goes hand in hand. So here also the diabetes and hypertension, both the evils which are actually plaguing the world now. Actually, the most major cause of mortality, it's not the corona actually, and it is diabetes and hypertension. Both of them, 50% of the population in the world is being taken away from this planet every year by hypertension and diabetes. If these two diseases are not there, I think 70% of our doctors will not have any work only, basically. And we are probably not required by the society also at the same time. So it is such kind of an association between diabetes and hypertension.
Okay. So that in fact makes it very clear. And as we've already spoken about how much can be done to prevent it, and so how easily they can be prevented, I think there's enough food for thought there. But we cannot, obviously finish any discussion without talking about, what the future foretells. So there is this last question that I have. I would like Dr. Varughese to answer it, but please anybody else also can pitch in later, because I would really like to hear everyone's views on that. Dr. Varughese, given the worrying numbers worldwide, what are some of the new approaches or the treatments of high blood pressure which are being done or which are being considered or are getting some good results for the treatment of high blood pressure, particularly to avoid kidney ailments or other cardiac diseases?
Okay. Before I answer that question, I was just looking at the numbers of hypertensive. The highest statistic from India in one study was as high as 47.9 by Gupta et al. 2004 from Mumbai, sir. There's 47.9% of the study percentage people had hypertension. That's the highest prevalence we have. And before I try to answer your question as to what the future portends, I want to add one more thing. We nephrologists talk about potassium restriction for our patients, which we have not talked about as part of our nutrition advice for patients with kidney disease. Now, since we are all nephrologists sitting here, three of them are all quite senior to me, and we all advise people to be on low salt and low potassium. So they are said in different sentences. The reason I am saying this is patients are buying salt which contains low sodium, and unknown to them, the company has got potassium chloride as a substitute for sodium chloride. So actually the salt that they're using is actually poisonous for them. So nowadays I've been telling patients, you look at the cover, if it contains the word potassium, don't buy that salt. They'll ask you, can you buy this? Can you buy this? And I don't know the different brands of salt that are useful. So I tell them, look at the cover. If it says potassium, don't buy it. I'm not sure whether the same thing has been noticed by others, but it certainly is a problem. Now, what more can be done is a good question. There are some who believe that, am I audible?
Yes, sir. Absolutely.
Yeah. There's some who believe that essential hypertension is a lot to do with mineralocorticoid receptor issues, and they give mineralocorticoid receptor antagonists. But the risk of high potassium is there. In my own mind, I think that The most important is avoid salt, like was emphasized so many times, and that cannot change. The other drugs, some of them become ineffective if they take salt. For example, ACE inhibitors, ARBs, they don't work if you give them, if the patient takes more salt than necessary. So disease specific. So if somebody's got albuminuria, and even those who don't have albuminuria, there are some good studies which actually have compiled all the data and found that diabetics who are not hypertensive, even if they're not hypertensive, if they're given ACE inhibitors or ARBs, they do not develop albuminuria, or what is to be called microalbuminuria. There's some fantastic data which shows that. It's of course compilation of many studies data together, but some meta-analysis which shows that non-hypertensive patients just given low dose of ACE inhibitors, ARBs prevents albuminuria. Good advice. And therefore, in hypertensives, diabetics, ACE inhibitors, ARBs, both are saying the new mineralocorticoid receptor antagonists that are coming out, some good data yet to be used in the country, so we don't have any hands-on information on it. Beta blockers, where they indicated, some people say most people are likely to require 2 drugs, therefore start with a combination. That's another set of advices which some societies, some hypertension societies give, cardiology societies give. I think the bottom line is that irrespective of whether we require 1 drug or 10 drugs, your blood pressure must be controlled round the clock. So the obsession of buying a blood pressure machine and monitoring it, like say once a week, and making sure that all the numbers, like Sir said, are your numbers right, are your figures all right. That, I think, the obsession of keeping them all right is half the job. It's half the job. Yeah.
Perfect.
That's all from me.
Yeah, perfect, sir. Anybody else would like to read it? I have time for one more comment from somebody. If somebody would like to add.
Hello? Hello?
Yeah.
I just wanted to stress one point. The general perception is that blood pressure belongs to cardiologists. Even when patients come to us, they say that blood pressure के लिए दिखाना है तो कोई cardiologist का नाम बताओ. So please, through your forum, you tell them that blood pressure is basically a problem to be tackled by nephrologists.
Okay. And
as Dr. Raju said, that kidney is the culprit, and kidney is affected by the blood pressure. Kidney is the cause of blood pressure. So more than heart, I think it is kidney which is related to blood pressure. General population has to be told that whenever there is a blood pressure, please go for your kidney checkup.
Interesting. I think this is a very, very interesting new point for me as well, completely.
Yes. So you will also come to us and you will say, "Bhai, mujhe koi cardiologist batao."
True. Okay. I think it's about time we wound up.
Yes.
So now I just will give some final points and then we can just walk in AV. Hypertension, it's very clear after this discussion also, is one of the largest contributors to morbidity and mortality, with almost 30% of population, it seems now maybe the number might be more, suffering from the disease. Nationwide studies show that despite the disease and its complications being so common and prevalent, there is huge lack of awareness and lack of treatment and control of blood pressure. In the recent national and global trends, home BP monitoring has been gaining a lot of importance due to its role in the correct diagnosis of hypertension. We've stressed on that today in our discussion as well. Hence, the education of patients and their caregivers is of utmost importance and is the need of the hour for home BP monitoring. Correct BP measurements and monitoring may not be as simple as it looks, and even minor negligence in the procedure of measuring BP can lead to a huge difference in the measured readings. So now patients and caregivers may not be aware that measuring the BP immediately after having tea, coffee, or food is grossly incorrect. It may lead to a higher reading even if you have normal BP. Even an incorrect sitting posture while measuring BP can lead to inaccurate readings. Hence, it's important to educate and support patients in measuring their blood pressure the correct way. In this regard, JB Chemicals and Pharmaceuticals Limited, who are pioneers in hypertension management in the country, has taken this patient awareness and education initiative, BP Right Karo, another slogan we have here, which is a step-by-step, easy and patient-friendly guide to measure their BP right. Can we please play the AV now to know more about this initiative?